Take us through that adjustment period. What could people be experiencing right now?
Look, I think the most important thing for people to realise they could be experiencing is what we're calling fatigue. So I think everybody now in Australia knows what to do as we go into lockdown. They know the importance of staying connected with people. They know the importance, real importance, of reaching out for help when they need it. But what may be surprising to people is just how difficult it is this time round, because you're just feeling fatigued. So I think the call out this time is to don't forget to stay connected with people. Don't forget that it's okay to actually not be coping too well, but reach out for help. I think they're the really important things. And look, also as we go into school holidays, remembering about our kids and our young people, that we really need to help them get through this as positively as possible.
And people are obviously consuming a lot of the news, the case numbers, the
Yes.
latest news surrounding that. Is the message that people shouldn't be so hard on themselves, that it is okay not to be okay?
Totally. So it's okay to not be okay, but look, what I'd probably suggest is what's not okay is to actually not then do something about it. So do that reaching out. One of the things we found last time around, or throughout this whole one, is that if we proactively stay connected with people, that really helps. And when we're feeling really low, stretched, anxious, gosh, it makes a difference if you can put it in words to somebody and talk to them about strategies to cope. That's what has worked to date. So that's what I'd be encouraging people to do.
We're 18 months now into the pandemic. Do we actually know yet what the full impact has been on mental health, or is it still too early to say?
Look, we certainly know that there has been increased use of all of our mental health services. That is great. Yes, it means that more of us are experiencing that negative impact on our mental health, but we're realising there are services there, and if we reach out to them, it makes a positive difference. That's really important. We are seeing ongoing risks around mental illness, and we are seeing some increased presentations of mental illness. That's why with the things such as telehealth, where we know that we've got those additional services, really it's important. We're in this for the long haul, and we've always said that the mental health consequences are not going to stop with the vaccines. So remembering that our investing in our mental health and well-being is just as important as looking after our physical health, and reach out for that help if you feel as though you're going into a space where your anxiety is being raised, your concerns are being raised, or it's feeling a bit black. Don't hesitate, reach out.
Yeah, some really good advice there. We've seen recent surveys about the impact that COVID-19 is having on younger people in particular. How concerned are you in terms of the long-term consequences?
Look, I think we cannot take our focus away from our young people, from our young Australians. And I think it's behoven, in fact, on all of us to realise that not only do those of us who work in mental health need to ensure we have the services there to support them, but I think all of us need to remember that their world has changed so much, and we actually need to recreate in them, if it's disappearing, a sense of hope and a sense of positiveness, a sense that we will come out the other side of this. And I think those of us who have a few decades behind us do know that, we do come through these times, but for young people, they haven't had that experience. So I think looking after their mental health and well-being, realising they will be concerned, having positive conversation with them so that they're not keeping it locked up inside, are all things that all of us can do with our young people.
You mentioned at the start about COVID fatigue and many people feeling that way right now. The situation in Melbourne, the state of Victoria, they've been through several lockdowns so far. How might people there be feeling?
Oh, look, I think this is where we look at the cumulative effect of all of this. And just like when you don't get enough sleep over an extended period of time, you really feel the effects of that. What we can't underestimate here is that we have been mentally, psychologically coping with this pandemic and all of the additional stresses and anxieties since March 2020. That is such a long time. So I think all we can do is, just like when we're really physically tired, we cut ourselves some slack and we realise we need to actually get that rest. This time around, if you're finding it that much harder to just stay positive, to stay on top of it, even though it feels hard to reach out, that's why I'm saying it's so important. We really do need to make those connections with services that can help you find strategies. And the other thing not to forget, it does really matter that we eat properly, that we get enough sleep and we get exercise, those basic things to look after ourselves.
Yeah, some really good advice. Christine Morgan, thank you for joining us this morning.
Thank you.